In today's Your Healthy Family, how do you know the instruments that your dentist or hygienist are using have been properly sterilized? I spoke with Dr. Fred Guerra here in Colorado Springs, who tells me for his office and all dental offices, preventing the spread of communicable diseases is always a top concern.
The Center for Disease Control has issued guidelines that all dental offices adhere to or are supposed to adhere to. We're concerned about patients giving our staff an infection. We're concerned about the transmission of spread of infection from one patient to another, or we're concerned about our staff having an issue and giving it to a patient. In dentistry, we use a tremendous amount of disposables, whether it's cottons or plastic instruments. So anything that can be disposed of is disposed of. Anything that is reusable is going to be sterilized.
Now, there are strict protocols for properly sterilizing dental instruments.
And that sterilization process involves a disinfection period, a soaking period, a manual scrubbing period, and then instruments are placed in a sterilizer. We do what's called a spore testing, and that's required to be done weekly. In other words, they're just not running them through and assuming they're sterilized as actual proof that the sterilization process was effective.
When you go to your dentist's office, Dr. Guerra says there are some signs you can look for that will indicate proper procedures are being followed.
When you come into the dental treatment room or the hygiene room, you may see instruments that are bagged and that are opened in front of you, or you may see the instruments that are already out. That just means your provider or their team is ahead of the game, they're ready for you, and they've opened up a set of sterilized instruments ready to go. If you have concerns, certainly ask your dentist, your hygienist, what are your procedures for sterilizing your instruments? And they'll be happy, or they should be very happy, to show you how they do it and to share that information with you. We always like to tell our patients there is no stupid question. We welcome all questions, and I'm sure your dentist would do the same, because patients just feel more comfortable if someone will take the time to explain it to them.
The same principle should apply to visits with all of your health professionals across the board. If you have questions, ask them. For Your Healthy Family, I'm Ira Cronin. For more health stories, head to yourhealthyfamily.com.